Hello and welcome back to GP Video Podcast by Nadia. So we are continuing with prostate cancer and I will be telling you in this video podcast 6 important points about prostate cancer. So we've already discussed 3 points which were the most important one. And if you have missed that one, I would urge you to please go back and listen to that video podcast which says 3 points about prostate cancer because that is very, very important. Those points were the most important ones, but I'm not going to repeat them in this one. I'm going to tell you the new points. So, number 1 point. The 3 main risk factors for prostate cancer are increasing age, ethnic origin, and genetic predisposition. So, increasing age, ethnic origin, like your ethnicity, your nationality, and genetic predisposition, not nationality, but ethnicity basically, and genetic predisposition, with age being the most important. So of course, as we have already spoken that it occurs with the increasing age, and usually if screening has to be done for the men without any risk, like with average risk factors, without any first hand family relative, like first degree family relatives, then we just start screening them if they want after 50 years of age, and average age is around 68 years, but 25% of cases occur in men below the age of 65. 25% of cases. And as I've told, mentioned in my previous podcast, that the 2 patients that I've seen in 2 days of mine with prostate cancer, one is 47 and one is 60. So, and both had family history of first degree relative of prostate cancer. So, yeah, though the chances increase with the increasing age, but we should not ignore the 25% which can occur below the age of 65. So that was number 1. Number 2, prostate cancer is most common in black males. So when we talk about ethnicity, here comes the ethnicity. It is most common in black males, then white males, and least common in Asian males. And the risk of developing, as we have already discussed, prostate cancer is increased in men with a positive family history of prostate cancer. Number 3, overweight and obese men with prostate cancer are at an increased risk of disease recurrence. So I'm not saying that obese men are at increased risk of getting it, but once they have prostate cancer, they are at increased risk of recurrence. They are also at increased risk of treatment-related adverse effects, obesity-related comorbidities, earlier progression and development of metastatic disease, and higher all-cause and prostate cancer-specific mortality. So once they get the prostate cancer, obese and overweight men, then they have chances of all these things that I've just mentioned. So they have chances of more treatment-related adverse effects. They are more at the risk of developing metastatic disease, and also more at cancer-specific mortality, which is the percentage to die. Okay. Number 4. The Faculty of Sexual and Reproductive Healthcare Guidance advises that there is no evidence of a causal relationship between vasectomy and prostate cancer. So there has been a myth that, you know, what men who go for vasectomy, they are at increased risk of developing prostate cancer. There is no causal relationship. Number 5, most men with prostate cancer are asymptomatic, like they do not show any symptoms at presentation, and initial suspicion is only raised following screening with PSA testing and a digital rectal examination. So the 2 patients that I told you about today, one of them who's 47 years old had no symptoms, just had family history. I did a PSA that was raised, went to the urologist and was diagnosed with prostate cancer, while the other man, who was 60 years old, he did come in with symptoms, which was all the benign prostatic hyperplasia symptoms, like difficulty in passing urine and sometimes blood in urine and all that kind of symptoms. So, but usually most men with prostate cancer are asymptomatic at presentation. Number 6, which is the best part, is prostate cancer is often curable, with overall survival depending on the initial stage of the disease at the time of diagnosis. Prostate cancer mortality is strongly related to age, with the highest mortality rates in older men. So again, it is age related. So if you are diagnosed at an earlier stage and at a younger age, if you get it, then the chances of survival are very high. But if it is diagnosed at a later age, at a later stage in the cancer itself, and at a later age, the chances of non-survival or shorter duration of survival is more. So we've discussed 6 points, 6 more points about prostate cancer, and we'll go back to some other topic. But this was something that happened to me today. Like, I saw 2 patients in 2 days, so I just wanted to make sure that I whatever I know about prostate cancer, I should throw light on it. Thank you so much.